be here today. I am so honored to just share a little bit of my thoughts with you, if I might. Some of you might know me from being on your TV at 2 p.m. I'd like to forewarn, thank you, that my voice can bring back a thing or two. But others of you in this room, I've known from doing this work that we do together my entire career. And so I want to begin by saying I am a doctor. I am 60 years old. So I've been at this a while. I'm an Ohio girl through and through. Grew up in Youngstown, Ohio. Trained in med school in Wildtown. It is very, very good vibes coming from over there. And I went to Neo-UConn, Neo-Med, BSMD, 6-year program. So trained here in Ohio. I am not what you would call a politician. I jokingly say that my last election was in high school. So it was student council president, which I did win, by the way, so we're 1 for 1 in elected office. But I am a lifelong public servant. And the type of doctor I am is preventive medicine and public health. Now, I started out in pediatrics, and I'm gonna tell you why I became a doctor, but I ended up seeing things much too late. A lot of the struggles folks were dealing with, I realized that I wasn't getting to the root causes, and that's when I discovered this field about the social, environmental, and economic determinants of our well-being, our health, and that is the work I've done. I've done it, I've worked with 5 different governors over the years. A lot of you know me from working so closely with Governor Mike DeWine. But I did my residency training when Bob Taft was governor to learn all of government. And I've worked on projects, I worked on a project as a professor at OSU with Governor Kasich to expand Medicaid, because we realized that when people are uninsured, all of our healthcare costs go up and it improves access. We know that is a big hurdle we are facing now. And of course you saw me with Governor Mike DeWine. My career has taken me from global health to academia to government. I was actually working at something called the Columbus Foundation right here, one of the largest community foundations in the country. I was working on the issue most particularly of youth homelessness and all the reasons that our young people are homeless when I got a call from Governor DeWine. The only question he asked me when I first met him was, tell me about your childhood. Where did you grow up? So I was very honest with him. That's always the question he asked, and now I ask it of everyone I meet and all my employees, they know that. But I was very real with him. I said, I grew up in Youngstown. I had a very, very rough childhood. I always want to acknowledge that my story is not unique. 50% of our kids are living in poverty, up to 70% in some parts of our state. My brother and I were frequent flyers in children's services. A lot of abuse, a lot of neglect. We were even homeless in the middle of winter in Youngstown. Finally, at the age of 12, we were removed from that situation. We literally moved a mile away from where we were in a tent. But instead of moving around all the time like I did, we stayed in one school. It was nothing fancy, an apartment. My brother and I shared a bedroom up through high school. But I stayed in one good school. And then I got in that med school and my life got better. But I was haunted by the kids I left behind that were just as smart, just as nice at all the many schools. But I watched our lives go different ways. I was learning that your zip code can predict on average how long you will live, what kind of life you will have, so much more than your genetic code, everything I learned in med school. And I remember a very distinct day in med school when the World Health Organization made their definition of what health is. And it stunned me because what we mostly learn is sick care when you're at training, but they said it was a complete state of physical, emotional, and mental well-being, not merely just the absence of disease. So that, plus this childhood, gave me this want to make a difference and to prevent the bad things from happening. And when you grow up like that, you notice people looking the other way. They're seeing things. you get older, you realize it's not that they didn't care, they just didn't know what to do about it. But I never ever forget the people who did not look the other way. There was a couple who would pull my brother and I up on their front porch walking by just to feed us breakfast because they knew we were hungry. So this not looking the other way has driven me through all of my medical work. And when we talk about mental health here, I've never seen it. I'm always about the whole social determinants. I see mental health as part of our overall health. I see it from prevention all the way to treatment. I see a whole spectrum of things, and I've worked on about every issue that NAMI works on, and I've worked with NAMI over many years. But this whole part of this is about not looking the other way when people are suffering. I think that's what we're being called to do in this moment that we're living in. And I am running for governor because people in this state are struggling. They're working harder than they ever have. They're doing everything right. It's just not adding up. And I refuse to look the other way when we have some corruption and some bad actors in our state house who have been taking us backwards. And on nearly every measure, we've been going backwards in Ohio. I believe it's time for change in Ohio. And I say that as someone, thank you. This isn't a partisan statement I am making. This is so important to say. I have never been partisan in my life before running for office. I've always had to work with people on both sides of the aisle to get things done. That's why you saw me work with Governor Mike DeWine. It was an honor and a privilege to serve with him. And one of the reasons I did is because he cared so much. We didn't agree on every issue, but he cared deeply about kids, as I do, and mental health. And so right from the beginning, I worked with him on Recovery Ohio. I worked with him on an opiate settlement where we learned from the tobacco settlement, most of which did not come to our communities or treat addiction. Most of it filled potholes in a downturn. So this time we did something a little different from that experience. The governor and I got 88 counties together. It was a lot of good food that Fran made, quite frankly, in the governor's mansion, and they were held hostage. And we literally said, what do we do differently? Because we all remember, I worked at the Columbus Foundation. We didn't have $4,000 when the opiate crisis began to give away, and feds weren't yet doing anything. We all agreed in Ohio to share 50% of the settlement and put it into an endowment so that we could live off of the interest in perpetuity, so that we were ready for the next addiction and what could come. This is a novel idea. I don't think it's fully been realized yet, but this was agreed on by getting everybody to row together. One of the functions we often forget about is governors are also catalyzers and conveners. The governor does, the levers of a governor through the cabinets and the boards and commissions are the social, environmental, and economic determinants of our well-being. And it is about empowering us and communities to all row together to solve the wicked hard issues. And as we face what we have yet to do in mental health, we know that it is not government alone. I want you to know that I am very committed to take the work we've been doing and go to the next stage. I think there is so much more work yet to do, and we'll be talking about it. But I think the other part of it is that we need to do that in partnership with philanthropy and the business community and our hospitals and healthcare systems and our local communities and our law enforcement. It's about making a commitment to Ohioans that everyone deserves the chance to reach their full potential. And they need to have us alongside of them making that possible. We face a lot of threats coming. Medicaid and what is happening in Medicaid is a big one. We have systems on the collapse right now. We have 11 rural hospitals, mental health in Cleveland. We have an initiative coming through that would, in the wrong hands, force people off of rolls when we know that a quarter of Ohioans use Medicaid at every age. We know that a lot of children rely on it for their healthcare services. And this is something we absolutely need a governor to make sure that we keep working to keep everyone insured and working together to keep these services. We know we have issues with property taxes. where a lot of those taxes at the local level serve some of the organizations we work with. And we have to do something about property taxes. They're too high. It's one of the many, many costs people are facing. But the fact is, we have to be able to also make sure we have enough resources. And one of the reasons our property taxes have gone up is that we haven't, in a very corrupt and special interest state house, been empowering our local home rule communities and giving our local funds, which puts pressure on all the systems, including mental health and addiction. So all of these things, when you look at it as a governor, are one set of things that surround the people we all care about. I personally lived through so much as a child. I'm very, very open about what it is like. I even remember in COVID being very open with Ohioans who I knew were struggling to say, I know what it is like to struggle. And I share my story, not as my opponent would say, that it is a victim story. This is not a victim story. This is a human story. All of us are faced with a thing or two in our lives. When you go through the level of trauma, in an ACEs score somewhere around 7, I know what that means to have PTSD. And I'm very blessed that I was able to get the kinds of help and therapy and treatment. I'm very open about mental health in my story because I hope that it inspires someone else to not give up hope. I hope that it inspires people to not be scared of stigma and not seek the kinds of help. And that kind of help helps families, it helps our communities. And I think about prevention, about how we help our children. So much of mental health and what the governor I fought for was in school so that kids like me might have access to services even while we're experiencing things. And this is the kind of fight we're in so that everyone has that holistic well-being that we all desire. My opponent has literally said that my story is one of complaining about something that was done to me, about sexual abuse. I've fought my whole life to help people who are the victims of crimes. You need to know that and have preventive services in place for people who can seek help. I have fought for housing and healthcare issues. I have fought for what we do about bed boards in communities when there is nowhere to go, and to be able to have stabilization treatment and crisis treatment. These are the issues I've worked for my whole life, because when I travel this state, which I have been doing for almost 2.5 years now, listening deeply and going everywhere, we see record crowds of people showing up. It does not know party. It has never known party who shows up. And everyone is exhausted of the hate and the chaos and the vitriol. They're exhausted of being pitted against one another. They are longing to have public servants again who actually solve problems instead of make problems. And it isn't about party, you have to hear me. It's about all of us struggling, and 95% of the things I'm hearing about, healthcare costs, aging in place with dignity, housing, education, workforce, mental health, and even things that people dream big of, none of it is controversial. And it's so vitally important that as we make the decisions going forward, that we are picking public servants who are actually going to fight to help make life better for all of us. And I'll last say, kindness is not weakness. I think it is a big, big mistake to see kindness as weakness. I am a scrappy kid from Youngstown. I am no victim. I am resilient. I am strong. I could run COVID better because I might be a little bit hypervigilant. And some of those things you go through actually give you skills and strengths that you can transform, and that you can have empathy, and you can have strengths to help people get through. Kindness is a fierce commitment to seeing the humanity in one another. It is a fierce commitment to justice and leaving no one behind. And it is an honor and a privilege to have served. At 60 years old, I've been a doctor and doing this public service for almost 40 years. But I am very honored to be in this fight with you, to work alongside you as we build what comes next. Thank you. Thank you so much. Please.
Okay, there we go. Dr. Acton, I'm a board member, nonprofit director, and I also represent Ohio on the national level for NAMI as a peer council representative. NAMI Ohio has pushed for a more person-centered approach to mental health services. What barriers do we need to remove to allow people to be productive members in our Ohio communities?
Thank you. So part of how I've been trained is seeing both you and the community as my patient. That's what public health and preventive medicine is about. That's sort of what you saw me doing as a health director. And everything should be around a patient and family and community-centric model. You know, what we want are services and systems, and that isn't just government, as I said. It's how the nonprofits work. It's how the community is built up around us that create the conditions in which we can either flourish or not. But when I see a person, it's through something called the socio-ecological model. So I see you and your life story from a very developmental lens, all the experiences you've had, and I see that from before you were born, and I see it as you're dying, and across that spectrum, and all the things that you have sometimes within your control, the things in our health and our mental health, which I see is completely a part of it, are about a third of them are things that you can actually make choices about, but 2/3 of them are things that we have to solve together and set up around you. Your genetic code can only predict so much, and all the things we can do preventatively to be healthy. But then I see you in the context of your family, and then I go out concentric rings, I see your workplace or where you are in school or where you're getting treatment at. I see systems around you, and it's all based in relationships, and then I see the societal systems that we built, the justice system, the healthcare system, the systems that surround you, and then the policies that surround you. And my job often is to diagnose things that get in the way of you accessing the good things, the barriers. As governor, that is my job, to be able to create the conditions and give the most resources I can, and quite frankly, to the most community level I can. One of the things I did not notice in our state house is I had worked with the governors past, Bob Taft, that far back, Joanne Davidson, who I used to work with. I said, what happened to home rule in the state house? I don't know, because our job is to often get barriers out of the way, but try to empower you, because what works in your community around mental health is very different than what's working in your community. And so I want the most flexibility there. My job is to set tables. What you saw me do in COVID is put hard cards on the table. We always begin from there, because if you don't know the ground you're standing on, you can't solve anything, so that means being honest. I became kind of famous for being brutally honest. But that was for a purpose, because when you do that, you bring people with lived experience to that table, and then you bring all the different systems around that table to try to solve things. I see the patient in that very same way. So my job is to help empower your organization. I'm going to be coming to NAMI. I'm going to need your help so much more after I win than even to win, and I know I could use everyone's help to be governor. But the reason is because you've been doing the work. You know who the best people are. You know who the experts are. You know the programs and best practices that are working and not working. And you know the cutting edge of what's done in another state. But my job is together, we are going to build the next stage that we can go to. And we will go through thick and thin together. And there will be times when you lead that you can't fix everything. But I will absolutely promise you that no one in this state will ever be unseen by me, and I will be beside you every step of the way. And that's the way we do the work. I want to add that when I say we have a broken state house, I want to explain this to folks because it can, again, sound very partisan. When I was an advocate for Children's Hospital here, and some of my first work was in early intervention programs, that's what I was doing with Governor Taft. I would fight for things as a child advocate for policy. And I would go in with Joanne Davidson, and we might argue about a thing or two. But at the end of the day, we would get a policy done, and that policy would get implemented and would make our lives better. When I walked in this state house, I felt like the Ted Lasso of politics walking in. What has happened is it is no longer about party, Democrat or Republican. What we have now is extreme wealth, power, and special interests and playbooks that are being shoved from outside of our state and elsewhere through our state houses with big money to force issues that no one on either side voters would be bringing to bear. And we pay a lot of attention to federal. We know what's going on in the news, and we often know what's going on locally. But it's the black box of our state houses where we often can't name who even works there. That is there and has been an issue. And in working alongside a Republican governor, seeing some of the struggles of that effect. It is very vitally important that we are known for having one of the most corrupt state houses in this country. And I know that is not what we're capable of. And during that time, our health outcomes went down on every measure. Our educational outcomes are going down, mental health outcomes, different things. So even when you have a governor fighting strongly with passion for an issue, that governor has to have partners that can help move that issue forward. So I ask of you to pay very close attention in this election. I believe whenever you have supermajorities or gerrymandering on either side of the aisle, those kind of playbooks and corruption can take place. But I know from working with people on both sides of the aisle that there are great people who want to serve again, that are in there right now that want to serve. So it is vitally important that we pay attention to this place called the State House and all of those races as well. They will be very important for the work we do next. So I answered your question, but I wanted to say, I believe in centering us and that the systems we build follow our life journey.
Thank you, Dr. Acton. Thank you for joining us this afternoon. My name is Joyce Campbell. I am the past chair of the NAMI National Board of Directors and the past chair of the NAMI Ohio Board of Directors, and also a very happy retired mental health court judge. My question to you is, over running a mental health court for over 20 years, we saw the familiar faces. My question to you is, how would your administration, how would you decriminalize mental illness? Because I'm a big believer that mental illness is not a crime.
It's not a crime.
And what would your administration do to have a community-based continuum of care so that we do not have people entering the criminal justice system from the very beginning?
Thank you so much, Judge. So a lot of this was the work you are speaking to is also work I was doing at the Columbus Foundation. And one of the issues we have, and when I say the social determinants of our well-being, for me as a doctor who wants to heal, who absolutely does not see mental illness as a crime or a weakness, let's just be clear, and that many of us will experience something related to our mental health over the course of our lifetime. We know that statistically. One of the problems that we face is having systems that exist in silos. And that is why when I talk about this convening and catalyzing function across systems, one of the ways I want to walk into office not unlike Governor DeWine, who's very committed to mental health, created Recovery Ohio. He created a system that didn't even exist in the state silos to try to thread a needle on an issue we needed to move on. And what I would like to do is create, and we will be working together, I've already been in partnership with some folks in this room, to start creating a way of looking at this next, because it is how we break it down that will affect the local community. And so helping the continuum of care locally is very dependent on the flexibility of funding and programs that we can help you thread the needle on at the state level. Because a lot of what you end up doing at the local level is to try to piecemeal a justice system with a mental health system, with a healthcare system and a Medicaid system, and children's service system. And really, it's our people moving through all of it. So one of the things I care a lot about are some of the issues that you've been working on in your court. But one of the things I'm hearing on the ground, listening deeply everywhere, is, we don't have enough crisis support teams in every community. This is something that can help prevent people ending up in the wrong system. That we don't have enough stabilization centers or places to put people. We know we don't have enough beds, and we don't have enough treatment and healthcare providers. So even when I'm thinking about you in the continuum of care level, I'm thinking about the training and how we fund our colleges and how we fund degrees so that people can be inspired to come into mental health and not have a ton of student loan. I've worked on things like I was part of creating the whole community health worker system. When we first started doing that, OSU was deeply involved. Because I'm taking people right from neighborhoods to give them early skills that they can then somehow. And I think about the fact that we have rural hospitals collapsing and people are telling me they're going an hour and 15 minutes to deliver a baby or to try to get therapy. I mean, babies are being born roadside right now. So we absolutely have to have telehealth. And so all of these things, these levers of a governor, all of those things interact together. And so I also would ask you to watch closely the races for Attorney General, the races for Supreme Court, the races locally, and take so much care in helping us build back. It's very easy to get caught up in the politics of the moment, but I can't say enough. Right now is an inflection point in Ohio. I'm very proud to say I believe Ohio is in play in this election. I think this is a crucial moment in the choices we make. But we have a lot of things to build back together. We did not get here overnight. A lot of our systems I've been mentioning are very underfunded. And so many of the networks that you would have used from the bench are just hanging on by a thread. And so the problems that we face, I see 10 years out and work my way back to this moment of what we have to start building together again today. And that takes good public servants who answer to us, I don't care what party they're in, but literally want to solve the problems of our everyday life. So this is so, so important. I've been working on the wraparound kinds of things that you would like to refer to when you are a judge. And I'd be honored and privileged to learn from you more what worked and what didn't work, and for us to work together. When I say I have hope for Ohio, and I used to remember, I say often public schools saved my life as a kid. We have public schools under duress in the state right now. Mental health is there, job stuff, all that is in the community. Libraries saved my life as a kid because I could read books and know life could be different than the one I was living in. That gave me hope. My definition of hope is optimism plus a plan. A plan. And the fact is, we didn't get here overnight. Ohio is like the United States of Ohio. We are the complete demographic of this country. We are the 7th or 8th largest state, depending on where you look. We are capable of great things in this state. We are capable of building the systems that everyone models after as they have in the past. So we didn't get here overnight that every system that we are all working with is so taxed. And we know a state can't solve everything that happens federally, but governors and attorney generals can certainly be pushing back. But I believe Ohio, when I look 10 years out, can be the healthiest and have the best systems again, and have the best education, and have the best ability of workforce training, and have mental health that is centered in communities, and can serve people with disabilities, and can actually create preventive systems where we teach in our schools the skill sets that help us be resilient and have good mental health and know how to ask for help, that help families do that. I believe that we can build things like I believe Ohio can be the largest integrated park system in this country, because I've actually worked on systems like park systems that provide nature, which helps us with our mental health, and is actually something that we sit on assets in this state for right away. We, right now, live in a way where we just wait for the next hammer, the next shoe to fall. I go around this state talking to local officials where they say to me, Amy, please just don't give us another unfunded mandate. Please don't bring a National Guard to my city. People are just keeping their head down right now and treading water. I believe we can want nice things in this state again. We deserve great things in this state again. We have a moment here. I beg of you to come with me on this journey, because I believe we can build the systems again with your help, with all of our help, that empower our people again, empower our communities, and put that bar a lot higher. And please know I'll be with you, doing the work I've done my entire life, fighting stigma myself personally, when I have, a president's son saying that I'm a lunatic right now. So this is not how you stop stigma. This is not the role models we need to be. It is an honor and a privilege to lift the needs of everybody we serve alongside of you. Thank you so very much for having me.